Hello and welcome to this recording of the Partners 2020 Ask the Experts Industry Webinar for Pharmacy. This session was hosted by our careers consultant Jo Craggs, and she was joined by our Newcastle University alumni Nketia Obed-Arthur, who currently works as a pre-registration pharmacist at Ashford and St Peter's Hospital. At the start of this session, Nketia will be providing a presentation to tell you a little bit more about himself, his time at university and his career to date, before Jo leads a Q&A with questions that have previously been submitted by our partner students and from those who were able to attend live. Without any further ado, we're going to hand over to Nketia to tell us a little bit more about himself.
Hi guys, so my name's Nketia. I'm a pre-registration pharmacist at Ashford and St Peter's NHS Trust. We are the largest general and acute hospital in the Surrey sort of area. And even though I'm primarily based in hospital, I have done a few rotations in general practice, community pharmacy, mental health, cancer services, etc. And this is just a bit of a short presentation for me to talk a little bit about myself, both before university, during the degree and now, and hopefully to give you a bit of insight into what being a pharmacy student is like, what being an eventual pre-registration pharmacist will be like as you all prepare to embark on the exciting journey that pharmacy has been for me, and hopefully will be for you as well. So I suppose we'll just sort of get started then. I'm hoping these slides work. Oh, there we go, they did work, brilliant. So prior to university, I knew I wanted to do something sort of healthcare related. So I picked biology, chemistry, and physics, and French AS as a bit of a wild card because, you know, having a language is always good. The one thing I did know is that I was very interested in the way that drugs work in the body. I had a real interest for having an understanding of how exactly the medicines that are prescribed to us and that we also prescribe actually help people. In the summer of year 12, I had the opportunity to work at a small pharmaceutical company called Morphatec. That was in Pennsylvania. I was on holiday there at the time, and they really focused on looking at biological molecules and how they worked in cancer and inflammation and other disease states as such. Originally, I did have a firm offer for pharmacology at the University of Edinburgh, and that was around February during year 13. But I wasn't actually too sure career-wise where a pure pharmacology degree would take me. And so between accepting that offer and results day, I did see that Durham University, which is now Newcastle University School of Pharmacy, were offering places at that School of Pharmacy, and pharmacology was one of their modules. So just focused on my A-levels, did better than I expected, got 2 A stars in biology and chemistry, and I received an unconditional offer for pharmacy through adjustment on results day. And I started my first term on the 15th of October 2015, which in the grand scheme of things doesn't actually feel that long ago, but I suppose in terms of actual numbers, it's been a while, and here I am now. And what I want to take away from that is that time will fly by, but it's a testament to how enjoyable the field and the degree really are. So during my university degree, pharmacy, as you may be thinking, as you may have been told, it is intensive, but that doesn't mean that you can't do other things. And I would strongly encourage you to sort of, you know, broaden how you spend your time at university when you are embarking on that pharmacy degree. With regard to the degree itself, I completed my dissertation in neuropharmacology. Really what my dissertation was focused on was looking at the relationships between brain structure, looking at task performance and illness severity in patients with bipolar disorder, specifically ones that had been taking lithium. Lithium is quite an old drug, so it was actually quite interesting to sort of see how three-dimensional models of different patients' brains related to different factors. So that was what I was focused on. And one thing that I would say in terms of preparing you for your career as a pharmacist is that there's so much importance in being able to do proper research. There have been many times on wards where I've been asked a question by a doctor or by a nurse about a certain patient regarding their pharmaceutical care. So I've been asked things such as, this patient's had a stroke, they can't swallow anymore. How can we change certain critical medications to formulations which they can swallow or that they can actually sort of take so they don't miss out on doses? So research is critical to your role as a pharmacist, and so the dissertation module definitely helps you with that. I did work hard. I did achieve a first in pharmacy, but I do want to stress here, and I'll mention this later on, that it's important that you find that balance between sort of pursuing your academic goals and then having free time and having sort of a balance between work and life. I will mention this towards the end of the presentation as well, but I just wanted to throw that in there. I was also a pharmacy parent from second year to fourth year. It's a completely student-led scheme where older students will mentor younger students, both academically and pastorally. So when you first start, understandably, you will find it slightly challenging, but you do have older years there to sort of support you in that transition from starting as an undergraduate to finishing as a graduate and then moving on to that pre-registration period. So do take advantage of that scheme as well. In terms of networking, I did find that Newcastle was brilliant in terms of helping me find opportunities beyond the course. So I actually went through the career service to find this one internship. I worked with Andre Young, who is one of the leads for NHS England, who was interested in really integrating community pharmacy with the rest of the NHS. And so I helped him develop training media for the Community Pharmacy Referral Service, which is now known as the Community Pharmacy Consultation Service. So that is where if you run out of medication or you are unsure about something, you can call 111 and they can actually refer you to a community pharmacy and you have an appointment with a community pharmacist, which I'm sure many of you may know. Some of you may even have used the service, but now it's nationwide, and I was actually quite proud to be part of that. I also took a part-time job at Penchville Pharmacy as a student pharmacist, and that was really me sort of taking in orders, managing the counter, and also dispensing a lot. In terms of volunteering, I did spend a bit of time tutoring underperforming A-level students in the local area, and I sort of took that enjoyment that I find in education to become an online tutor in both biology and chemistry, GCSE and A-level. By the time I finished with the degree, I think I'd done about 300 hours of tuition. I think now it's about 900 hours of tuition. At some point I'll have to sort of put it on the back burner a little bit because now I am working full time, but my point here is that there are definitely opportunities beyond the pharmacy degree. And what you'll even find is that a lot of these opportunities help you build skill sets which you'll use in your career anyway. So even if you find a pastime in something quite sporty, you may very well find that that pastime or that job opportunity feeds back into your career, which you're aiming for. So what I'll say is take as many opportunities as you possibly can. Now I'm a pre-reg pharmacist, soon to be provisional band 6 pharmacist at Ashford and St. Peter's Hospital. I've also spent a bit of time being a regional training representative for Health Education England. And that role really involves me collating views about the training of other pre-registration pharmacists across this region and then feeding that back to Health Education England, just so we can improve the current cohort's training and the training experience for future cohorts as well. I've continued the whole education thing. I've delivered some presentations for interim Foundation 1 doctors. So as you know, because of the coronavirus situation, a lot of medical students were fast-tracked in their 5th year to going right into practice. So what myself and the education program director at the hospital focused on is creating local prescribing assessments where we can sort of ensure that the quality of their prescribing isn't going to be compromised by, one, the very hectic environment that coronavirus has created, but also just to make sure that they're confident to go and make a positive difference in the lives of patients on wards. And I do sort of chair revision sessions in mini groups in BAME communities for pre-registration pharmacists, and I still sort of maintain that sort of online tutor sort of presence on my Tutor, the online platform. But enough about me, because I think I've talked about me a fair amount. I'm going to talk a bit more about the Masters in Pharmacy. I didn't really want to sort of copy-paste everything from Newcastle's webpage. It's very informative, and I've sort of put a link just at the bottom of the slide, so you can click on that or sort of navigate to it, or even a quick Google search can help you get there. But what I wanted to do was just sort of put together a diagram that really highlights the many different avenues that you will cover in this degree. You will learn things such as anatomy. So in my first year, I had the experience of learning anatomy in the anatomy lab, and that involved me using cadavers, which, as you can imagine, you know, in A-level biology, you may very well have dissected a cow's eye or maybe a frog heart, but a donated specimen that's completely human. A bit daunting for some, as you know, a few students did faint here and there. I felt a bit here and there from time to time, but it was definitely interesting. And what it shows you is that Newcastle School of Pharmacy doesn't just want to teach you through textbook alone. They really want to sort of give you first-hand experience in what you are going to do as a pharmacist, no matter what sector you may end up in. And that anatomy is really useful for clinical skills, where nowadays pharmacists have a very integral role in doing physical examinations on patients, where before it may very well have been the case that it was just a doctor or a nurse that would have been doing that. You'll be involved in learning about microbiology. You may be you may be involved in learning about pharmaceutics and chemistry. And I think the best way of describing the course specifically at Newcastle is almost like a spiral. So I know at other schools of pharmacy, it's sort of module based. So one term you'll just learn anatomy and one term you may just learn chemistry. But at Newcastle, you're always learning everything at the same time. And I would argue that's particularly important, because as a pharmacist, you're not going to be looking at things in isolation. You need to look at the bigger picture. So many times I've come across patients where I've had to consider multiple things. Say, for example, a patient presents to the ward and they have a chest infection. So your knowledge of microbiology may very well help you identify what the causative pathogen is. But then you may need to consider the patient's age, and then based on that, you'll have to consider what sort of formulation would be best for the patient. Is it oral? Is it IV? And that will involve pharmaceutics, for instance. And that may also link into anatomy and pharmacology. So your role as a pharmacist is very much integrated, and the School of Pharmacy at Newcastle definitely encourages you to think in that integrated manner. So when I started pre-registration, that shift from thinking as an undergraduate to a healthcare professional, I didn't find that particularly difficult, because that sort of integrated mentality had been sort of developed over a 4-year period, as opposed to me having to sort of cram it in a sort of a year period, as I've done in my pre-reg so far. And in terms of my experience with the Masters in Pharmacy, I think there are many things that I enjoyed, and this will vary between people. I've already talked about the anatomy labs a little bit, but I think clinical practice and problem-based learning, they've definitely been two of the aspects of the program that I've enjoyed the most. So problem-based learning presentations in third year, they were a time where the lecturers would say, you have this patient with this condition, ranging from schizophrenia to osteoporosis to even cancer. This is the medication that they normally take. These are some blood results. I want you to go away and come up with a presentation explaining how you would manage their care and why you would manage it in the way that you would. And that really prompts you to look at what current clinical guidance states for certain patients, and it makes you think in terms of a wider, almost like a wider picture, if that makes sense. And so because they give you that sort of independence to think as a clinician, that's something you won't really struggle to do later on. I do remember, I think problem-based learning for me, it started with that schizophrenia presentation. And that's one that's definitely stuck with me the most, because mental health was then and still is now definitely an area of clinical interest to me. And it's definitely an area in the NHS that I hope is funded more. But it's very interesting in the sense that there is so much that you can read, not just from a textbook, but from primary literature that other clinicians have even read and have presented. My dissertation, again, I think this is a bit of a controversial point, because most people don't really like thinking about dissertations. But like I mentioned before, my dissertation was on something that I really enjoyed. And the School of Pharmacy will definitely accommodate for your likes, what you'd rather not do and where your strengths and weaknesses are. And they will give you a research project that you're definitely interested in. And it's a research project which I still talk about now, even after I've graduated. And it's a research project which I've actively used on a day-to-day basis when dealing with patients specifically that present with mental health conditions. Some of the things that I found challenging, I think first year lab reports. So I know many of you, it's not too long ago that you transitioned from GCSE to A-level, and now you're thinking about moving on to university. And the one thing that I've always found is that it's transitioning that's the most difficult, as opposed to the actual content itself. And as you can imagine, I'm quite a chatty person. I think I managed to chat a good amount without sipping my tea at all in this period of time. But learning how to write in an academic manner was quite tricky to start off with. It started off with me learning, well, firstly, not to ramble that much, and then cutting out certain words that naturally I repeat when I write things out, and then learning how to reference properly. Fortunately, I found that Newcastle School of Pharmacy was really helpful and really supportive with regards to making that transition a bit easier. So they hold extra classes for academic writing. If math isn't a strong point, I know they offer classes there as well. You have a personal tutor. So that is a lecturer who is assigned to you at the beginning of the degree. And they have a very friendly drop-in sort of policy. But if you're unsure about anything, you can just sort of knock on the door and just sort of say, I'm not too sure about this. And they'll spend time and help you with it. And then naturally, easing in socially was also quite tricky, just because it was a much larger sort of society, and it wasn't one in which I knew exactly how to conduct myself all that well. I'm quite academic, so naturally, I liked putting my hand up, I liked answering questions, and not everyone's like that. So from time to time, it just socially, it wasn't as sort of integrated as I would have liked it to have been. But I think over time, that definitely got easier. So the one thing I'll say is don't put too much pressure on yourself to get everything right the first week you're there or the first month that you're there. Your degree is a good amount of time for you to sort of not only learn about what your future career entails, but also to learn about yourself. So just give yourself that sort of room to grow and develop, not just in pharmacy, but with yourself as a person. I think the most important thing to talk about here is how Newcastle really prepared me for pre-registration. So if you're unsure, the pre-registration period is a year in which you're either based in hospital or community, but most training years will allow you to sort of move between different sectors to get you as much experience as possible. And there'll be certain competencies that you will need to meet in order to demonstrate that by the end of the year, you are safe to practice as a pharmacist full-time, completely unsupervised. And there are many facets to that competence, and it's not just textbook. But what I found is that moving from Newcastle to Ashford and St. Peter's, in terms of my clinical knowledge, in terms of pharmacy practice, like I mentioned before, because I was encouraged to think in an integrated manner back then, I didn't really struggle to do that when I then started work. So when I had an F1 or an F2 ask me when I was on the orthopedic ward, for instance, back in November or October, when they asked me, this patient's presented with this, this, and this is what their bloods suggest, what do you think we could do? It meant that I could think about multiple things at once, and I could come up with an answer in which I could say, well, there's this option, which allows you to do X, Y, and Z. There's this option, which allows you to do A, B, and C. What would you like to do? So I wasn't too sure how to take that textbook learning. You know, I never struggled to take that textbook learning and then bring it into the workplace. In terms of clinical skills and calculations and law, which I found to be incredibly important, Newcastle dedicates time as well to teaching you about what legal things you need to know as a pharmacist, how you may need to use calculations as a pharmacist, and again, how you utilize your clinical skills as a pharmacist as well. As you can probably tell from my tone of voice, I definitely enjoyed my time at Newcastle. If I could go back, definitely would, because it was a brilliant period of time. But the one thing I'll also say is that that's a period of time that goes by really quickly. So make use of the time that you've got in that 4 years when you're completing the MPharm, but then also recognize that that MPharm is a stepping stone to your longer journey as a pharmacist. And the one thing that I'll always say is that in healthcare, you never really stop learning. There are always new things that are put out to read. There are always sort of ways for you to improve your clinical practice as well. So even though you may miss the learning that comes with the MPharm, you don't have to worry about it because there'll always be more learning to do. I just thought I'd end off with a few thoughts here and there, mostly some advice for all of you. I mentioned this before, but don't put unnecessary pressure on yourself to attain that first or 2-1 or, you know, and this kind of goes hand in hand with finding that healthy balance between studying for your degree and then enjoying the wider university life. So in my first year, I'll be honest, I can vividly remember falling asleep on the library sofa at about 4 in the morning, and the security guard told me very nicely that I'd have to go home if I wanted to sleep. I then dragged myself back to the computer because I had a summative to finish. That's something I would change if I could, because I can't do that now as a pre-registration pharmacist. When you move on to that pre-reg stage, you're working full time, and you're also expected to study and make sure that you meet your own competencies. So the sooner that you get into the habit of starting revision a bit earlier, not sort of letting things pile up, and then finding that balance between sort of going to lectures and going to practicals and then doing other things, the easier you'll find that transition from being an undergraduate to a graduate and a pre-registration pharmacist. Don't be afraid to ask questions, and this goes hand in hand with making use of your personal tutor as well. I can appreciate that moving on to that university stage is scary, it's a new stage in your life, but also take that change to be a way of encouraging something new. Think of it as something exciting in your life, and it's something which you only really get to do once as an undergraduate. You can go back to university and do further learning, but it's never really the same as when you first go to university. So if you have questions about anything at all, be it a lecture slide or be it the wider world beyond the classroom, don't limit yourself because you can't go back in time and then ask that question then, if that makes sense. And finally, just inspire yourself and others to read beyond lecture slides and open yourself up to change. One of the things that I heard from one of the faculty when I started my undergraduate was that if I started university and ended university the exact same person I was, I missed the point altogether. Ultimately, as not just an undergraduate, but as a clinician, you are always going to change. When I first started my pre-reg, I definitely thought pediatrics is really interesting. By the time I finished my pediatric rotation, I found, well, it's interesting, but there are other areas that I enjoy a lot more, like cardiology, for instance. And so don't put everything into one basket. Allow yourself to sort of, widen where your interests lie, is what I would say. And just allow yourself to change positively in a way which, when you step into the working world, you have a greater understanding of what's going on around you. Don't necessarily limit yourself to a textbook because, especially as the case with healthcare, it's not just a textbook. Pharmacy, I would say, is a brilliant career to be in because it's not just standing in Boots or Lloyd's or anymore. As I already mentioned before, I work in a hospital, which is something I didn't actually know all that well before I even started my degree. We have pharmacists that work in tertiary settings, in mental health, in industry as well. And now we even have pharmacists that hold their own clinics in general practice. So in the grand scheme of things, the sort of the profession of pharmacy is changing, and you should also allow yourself to follow that change as well. That's all I've really got to say, to be honest. I hope you found the presentation helpful, and I'd be more than happy to answer any questions that you've got.
That was fantastic, Nketia. Thank you so much. Really, really interesting, fascinating to hear you talk and to learn more about your journey. When it comes to questions, as we've said, we've got time for that now. I love this question. I think this is a really, really good one. Much more about your academic study and how you kind of, lived through that process. Any top tips for revising on certain topics that you did find a little bit uninteresting or greatly uninteresting?
Oh dear. Okay. I have to think about how I answer this question really, because I'm really previous lectures isn't again. Let me think. So, I'm trying to think of a specific area that I didn't find all that interesting. Not to sound cheesy, I found a lot of it interesting, but I suppose. Okay, no, I've got one. Okay, so one area that I found not too interesting, and it wasn't because I don't enjoy it, but just because it's a lot of memorization, was pharmacy law in second year. And that was purely because it's a lot of content, and a lot of it, you just sort of know it or you don't. In terms of how I study and how I revise, I always try to find links between them because I always like to think about the bigger picture. So sometimes what I would do, especially with like physiology and pharmacology, I would sort of think, well, how can I relate this to wider practice? So I could do that with a lot of my other topics, but I couldn't really do that with pharmacy law all that much. In terms of a tip of how I ended up revising, I just played to my strengths. In terms of my notes, I like to write in full prose, and I also like to highlight loads. And I'll use colors and I'll use diagrams and I'll print things off, and I'll sort of use glue sticks still, even though I think most people stop using glue sticks, but maybe year 9. I'll still use all of that in order to help me remember things. I like writing my notes throughout the year, and I always like going back to read them. And I'll just read them really lightly. So I guess to answer your question in short, I found it useful to start revision earlier on and to use things like colors, for instance, and to use diagrams, and even just to talk to others about it as well. A group of friends and I, we would meet together, perhaps maybe on a sort of Saturday afternoon. We weren't really doing much anyway. And we would just sort of talk through the topics. And what we found was that if we can talk through it in the same way that I'm talking now, very casually, we understood it more or less. So make use of what strengths you have. If you like using highlighting and whatnot, make use of that. I wouldn't say change how you revise compared to A-level, because if you've made it to university, you've demonstrated that you're academic enough to sort of in terms of your revision, in terms of your skill set. So don't change everything entirely. Just make use of what you've used before, because that's evidently been successful. What I would say.
That's great, thank you. I think that's great advice. I totally agree. We all work in different ways as well, and that's interesting. You said like the highlighter pens and so on. It's exactly how I'd work. So it is finding that your own kind of rhythm and your own routines, isn't it? Absolutely. Great, thank you. One of the other questions that came in, working alongside your study. Could you give us, I know you touched on that about kind of balancing your time out. That's obviously really crucial. Could you tell any more kind of insight into how you balanced your time out and work opportunities that maybe ran alongside your studies?
Yeah, so I guess in terms of now as a pre-registration pharmacist or back at university?
Okay. Probably both, probably earlier on in your academic.
Yeah, sure. So I suppose back at university, I guess my only form of employment, as it were, I was tutoring. I know it's part-time, but I think the amount that I was doing and volunteering more or less made it feel full-time. Going to lectures as well. And I also had a part-time job in my 4th year, and that was for Sunday mornings from 9 until 1. What I found was I tried to create an environment in which studying didn't feel like studying. So it meant that I could sort of say, okay, well, I'm going to do this for maybe 2 hours or so. I would put on a little bit of music that didn't have, mostly instrumental type of music. I'd open the window because fresh air is always useful, or in the evenings, a candle is always nice. And I just create an environment in which I can cover content without it feeling laborious. And so what that meant was I could sort of fit that in to other things that I had going on. I know a lot of people have timetables, and timetables are fantastic. I, for one, ironically enough, I didn't find timetables all that useful, because if I went onto Microsoft Excel or Word and created this lovely spreadsheet, and I put that on my bedroom wall, something comes up and then the entire timetable sort of falls apart. So what I used to do was I sort of make a bit of a sticky note and say, this is what I want to get done today, and this is what I've got at these times. And so then I could sort of juggle around what studying that I needed to do around the things that didn't really move around so much. Now, in terms of pre-reg, slightly more tricky because my working hours are 9 to 5:30, and then that's excluding if I have a weekend shift at the pharmacy, or if, for whatever reason, I have a late night. And I think my latest shift has been from maybe 9 to maybe 6:45. I also have to factor in that I drive to work each day, and that's the M25, about 20 odd miles each way, which isn't particularly great either. So what I used to do was, and even I still do it now, I wake up slightly earlier and get into work around maybe around 8ish. I then have an hour to sort of study and get my mind into a mindset where I'm then ready for clinical work. And then when I come home, I can just relax a bit instead. So what I would say is make use of what you know in terms of what your schedule is, and then work around it. Allow yourself to be flexible. And instead of sort of saying, I'm going to do 5 or 4 hours of studying today, give yourself a goal such as, I want to make sure that I understand what the asthma or COPD guidelines are by Wednesday, for instance. And then you don't give yourself that pressure to get everything crammed into one sort of finite time period, if that makes sense.
Yeah, great. Again, great advice. Can I just ask a little bit more, I suppose, in terms of the range of work experience you might have had previously? So touching on areas that maybe have kind of nothing to do with your degree, if you like. And again, just an insight into anything else that you've done. I know you talked about volunteering and so on. Any other roles, and how you might see the use of other work experience or other extracurricular activities and how they've helped you in your actual career planning?
Yeah, so I'll talk about the volunteering one. So student community action, it's definitely a program across multiple universities. I know it's definitely very active in the Northeast as well. And in terms of volunteering, my first year, I definitely sort of volunteered to tutor sort of underprivileged students. Now, I am not a teacher by any means now, but what I found is that that's been useful for me when I then teach other healthcare professionals on a ward level about how to sort of either conduct yourself or from a medicines management standpoint. So I do remember there was this one instance in which a patient had been admitted to the ward. The patient was epileptic, and epilepsy medication is quite tricky because some of it needs to be prescribed by brand, and a lot of the brands have very similar names, but they're quite different. So I then took that opportunity to sort of educate some of the nurses in that specific bay on the ward about the different anti-epileptic classes, which ones need to be prescribed by brand, and how important it is that when prescribing and then when administering medication, it's important to make sure that the brand is the same, because if the brand isn't the same, then the patient's epilepsy isn't controlled. Another bit of volunteering that I did was, I think this was before my degree actually, I did a Duke of Edinburgh Gold Award, and that was an opportunity to go to Mauritius, which was quite fun. And the project part of it was building a school for children who don't have the same opportunities that we do in the UK. And that was quite good because that gave me a sense of project management. It helped me sort of develop project management skills, which I still use now when it's come to conducting cross-trust audits, for instance, on reducing the frequency of missed doses on wards, for instance. So what I would say is it's important to have opportunities that you take that you enjoy. So if you enjoy volunteering, by all means, volunteer. And if you enjoy art, then by all means, dive into opportunities in which you can sort of cultivate your artistic side, or even sports. And what you'll inevitably find is that that will be useful in one or two ways, or both. One, the skills are inevitably transferable that you will use in different ways in your career. So I never would have thought that all the tutoring that I've done now and all the volunteering would be useful on a ward level, where it has been. And if not that, then it's useful in terms of having something else to sort of balance the demands of your career, which you will need because we're all human and we do need a bit of downtime here and there. So that's what I would say.
That's a great answer. Yeah, obviously in my role as careers consultant, that's something we talk to students a lot about, balancing your time, as you said, both for yourself, but equally that, come writing a job application, completing a CV, you've got this full range of experience that you can draw on to demonstrate and evidence those transferable skills. And they can come from an enormous, range of different roles. And it's sometimes, I think, a little bit, there's a lot of pressure, I think, sometimes for students to assume those roles have to relate to their industry, their subject, their field. And that's, as you've rightly said there, not always the case at all, because the skills do transfer across. That's a brilliant answer. Yeah. Thank you. What else do we have? Great question. Any top tips for achieving that first? I do remember you saying that you shouldn't put pressure on yourself to get that. So I think we should be mindful of that.
No, of course, yeah. I mean, what I would say is, well, firstly, it's a good question. I think it's great that you have, you aim high. And when I say aim high, that doesn't necessarily mean a first, because it's all relative for different people. And I think if you aim for what you want to achieve, if you achieve that, then you're happy with it, and that's the main thing. Now, in terms of a first, or even a 2-1 really, what I would say is that your success at attaining it is dependent on how much you enjoy the course and how much you see value in what you're learning. And that's not something the lecturers will give you. That is something that you need to cultivate yourself, because the lecturers did a great job in terms of telling me what I need to know, why it was important, but then it's up to each individual student to then take all of that brilliant knowledge and then turn it into something that is meaningful for themselves. So different people have very different reasons for doing what they do. I know a lot of people in pharmacy who enjoy the business side of it, and they may very well go down the route of community pharmacy and becoming a regional manager, which is fair enough. And I think that's a great sort of mentality to have. I've gone with the route of, I like making a difference in the lives of patients purely from a sort of a humanitarian focus. And so when it then came to revision, the one question I always had in mind is, how does the patient benefit from this by the end of it? And if I were to take this learning and put it in practice, would I be satisfied with the outcome that the patient receives? So really, to answer your question, I think it's beyond structuring your revision and, sort of good timekeeping. It's also about giving yourself an understanding of why you're doing what you're doing. Because I think at university, especially with pharmacy, it's 4 years. I guess this goes for any sort of degree of any length. After a while, it's very easy to sort of fall into a bit of an autopilot mode where you're just sort of going to a lecture, writing notes on it, and then going to bed and then doing the same thing over and over again. But if you actively take control of what you're learning and then remember why you're learning it, you tend to find that that's reflected in your academic performance. And the other thing as well I'll say is that if you don't do as well as you wanted to, don't necessarily focus on the fact you didn't do well. Focus on what you did well, and then also take into account what you can do better next time. So even though I got a first overall, there were definitely sort of summatives in which I achieved a grade I wasn't all that happy with. But instead of sort of focusing on the fact I hadn't done well and then worrying about whether or not I could get that first overall by the end of the degree, I sort of thought, okay, well, let me get feedback on what I've done and implement that feedback for next time so I can do better. So I think it's a sort of an accumulation of all those things, really. That's what I would say.
Brilliant. Yeah, brilliant answer. Again, thank you. One more question for me, and I think there might be a couple come in the chat box, so I'll maybe check in with Tom on that. Just one thing that I'd like to ask that's cropped up a few times from various sessions really, is that particularly in your field, you mentioned about the kind of the range of opportunities that are out there for pharmacists and where that might take, and that's really interesting. Kind of turning that around slightly, and obviously we want to keep a very positive slant on things, but I think it's also relevant and important to be aware of the challenges. Mm-hmm. So are there any particular challenges? Looking at that range of different opportunities that are out there is great. Would you say that you have faced any particular challenges during your career to date?
Yeah, no, I would say so. I think that's a good thing to mention, Joe, because ultimately I can say that pharmacy is amazing and it's brilliant. I don't want to give off the idea that it's perfect by any means, because no career choice is perfect by any means, but you will face challenges. But I think those challenges are important for your own development. I think working with different people I found has been tricky, not because it's inherently working in a team, because I quite enjoy that. But sometimes it's coming into contact with other people who sometimes don't have that sort of working in a team sort of ethic. So it was just yesterday, actually. One thing that pharmacists are very much involved in is discharging patients. We'll look at the discharge letter, we'll ensure that everything that's been prescribed is accurate to the discharge letter. We'll determine what medication the patient needs, what they don't, etc. And then from that, we'll then liaise with doctors if things haven't been done either from a legal perspective or a clinical perspective. And so one thing that I found difficult is sometimes telling another member of staff, not necessarily in the pharmacy team, but in the medical team, that this needs to be changed because of X, Y, and Z. And that can be quite daunting, especially as a pre-registration pharmacist, because you're quite young. And a lot of your colleagues are of a similar age to you, which can be a bit awkward because sometimes you worry that they'll have the perception of you that you think that you're better, but that's not the case. You're just trying to relay constructive feedback. And then naturally, you're worried about annoying people who are older than you as well. So it was just yesterday, for instance, that one doctor, her attitude wasn't that positive when I was trying to explain this needs to be changed because of X, Y, and Z. But the way that I sort of overcame that was, again, by thinking to myself, well, at the end of the day, it's the patient that's going to go home with this certain medication. So how can I change how I'm saying it so that it's not a very confrontational environment? And so I did. I just sort of said, okay, well, instead of sort of saying, this is wrong, this is wrong, this is wrong, I sort of went in and was saying, well, this is quite good. This is what could be done better, and this is why it could be done better. So definitely sort of facing adversity from other sorts of clinicians is certainly a challenge. And you get this in hospital, in community, in industry, over a variety of sectors. And I would also say, I think just naturally balancing work and studying for the exam that you need to pass to register, that's also been a challenge as well. Mainly because between your degree and between starting, you may feel as though as soon as you step into that workplace environment, you might feel as though you don't really know anything, but that's not true. And I would encourage you not to think that way, because you do know a lot. And the proof of that is the degree that you successfully attained by the end of that 4 years. All you need to do is learn how to apply all of that undergraduate knowledge to the workplace. And that's something that you have a fair amount of time, to implement. And last sort of challenge for me, just making mistakes and knowing how to sort of overcome making mistakes, because it does happen. So in healthcare, we definitely have a no blame culture. And if a sort of an error is reported, it's not to make anyone feel bad. It's so we can all learn why the error happened. Now, just based on how I am, I like to sort of carry myself to a particularly high standard. And I would argue that sometimes it means that if I have made a mistake, I blame myself a little bit more than I should do. And that's certainly challenging. If you're a similar type of person, then you might find that to be a challenge as well, especially when you're dealing with patients. But what I would say is, like I mentioned before, keep yourself open to change. Allow yourself to sort of develop as a person. So I think those are my 3 challenges that sort of come with pharmacy. Now, if someone from a community background sort of gave you an answer, it might differ ever so slightly. It might be, difficult customers. I've definitely heard of not so nice customers in a community pharmacy setting. I think I've met a couple, but that's not myself on a day-to-day basis. Mostly mine is from other colleagues, but again, that's, I think that's just pharmacy as a whole. But I hope that answered that question.
Absolutely, thank you very much. Yeah, I just always think it's important to kind of balance it out and give a kind of realistic view, insight again. Well, the question has come in there. Can you explain more about the problem-based learning style at all? Active approach, which again, touch on what we've already discussed really. And were there any challenges that you faced doing that particular side of your learning experience?
Yeah, sure. So the problem-based learning module, so we did it in 3rd year. I think they even started implementing it from 2nd year now, so a bit earlier on. So it's not just in the last 2 years of the degree. And that's really where you are given a patient case, and that patient case tends to be based on what you're learning at the time. So in 3rd year, our first sort of term was spent looking at mental health. So naturally, our first PBL case was on a patient with schizophrenia. And that PBL sort of module will require you to create a presentation in a group of other students. You will be tasked with sort of meeting up with those students, allocating slides, and you're really presenting to your lecturers about what you understand about the condition and how you would help that patient. There's no wrong way to present in terms of PBL. Everyone has their own presenting style. But I think with me, because I'm quite chatty, naturally I would want to say everything. But then I had to learn at the time that I can't say everything. I have to sort of let the workload be sort of spread out a bit. And also just with pacing in terms of how quickly I spoke as well, because I speak a lot more quickly when I'm nervous compared to when I'm not so nervous. I think the other challenge as well was about thinking about the wider implications of certain clinical decisions. So PBL isn't an opportunity for you to sort of rip facts about either schizophrenia or diabetes, etc., from either the National Institute of Care and Excellence or Wikipedia or whatever the website might be, and post it onto a slide. It's about demonstrating that you understand what the condition is and what the implications of that condition are as well. And it's a chance for you to demonstrate that you can think in the way that you would do in practice. I do have a couple of my PBL slides about on a hard drive somewhere. So if anyone does want to have a quick sort of look at what they looked like as a bit of an idea, I'd be more than happy to put them in the partners sort of summer school LinkedIn group. I'd be happy to do that. But I do hope that answers that question about what PBL is.
Absolutely, yeah. And thank you very much for offering to share them. That'd be great. Yeah, and we can use the LinkedIn pages, I guess, to do that. Yeah, brilliant. One thing, again, just a question or kind of a common question that's come out from a few different questions have been asked ahead of today's session. Basically coming to the same point. Gaining more opportunities, work experience, and so on within your field and within your industry. Are there any top tips you could guide us on that as to where to, just basically how to get into that industry and how to source opportunities?
Yeah, so I suppose in terms of moving from being an undergraduate to pre-reg, that's made a lot easier now because there's now a national recruitment program through which you're naturally sort of streamlined into a position. So that's called the Oriel program. And that is where, so you sign up in your end of third year, start of fourth year. You will have a multiple mini interview, which you can prepare for. There are questions online that are free to access. You'll also have a situational judgment exam in which you'll be asked, what would you do in this situation? And then based on how well you do, you can then pick where you'd like to go in terms of your pre-registration year. So in terms of moving from being a graduate to a pre-reg, that's relatively straightforward to do. You don't have to worry about writing out letters per se and then applying to specific places, because that was the case, I think, 2 years prior to my cohort. But the Oriel program started the cohort before me, and then I'm the second cohort. But in terms of all the networking and volunteering that I did during my degree, make use of the career service, because there are always things that are advertised there. I don't think there was ever a situation in which I thought, I want to do this, but I'm not too sure how to do it. Both in Freshers Week and throughout my time at Newcastle, there were always sort of signs sort of directing you on where to go in terms of just identifying things you could possibly do. And in terms of online tuition, if that interests anyone at all, I literally saw a flyer saying that you could become an online tutor and you didn't need any experience in teaching prior. All you needed to do was have at least an A in the sort of the subject that you wanted to teach. So what I would say in short is make use of the university, because there's lots of advertisement there. And then just look around and see what other people have said. And if anyone else has any other questions, then by all means, I'm more than happy to sort of answer any questions through my LinkedIn profile too. So, there are definitely opportunities out there. It's just how much do you want those opportunities that will prompt you sort of look for them.
Brilliant, yeah, and thank you for signposting our services. Obviously, as a careers service, that's exactly what we would do, would help you find those opportunities. So if you are, wondering where to start with it all, or you've got some options, or basically whatever stage you're at, that's exactly what we're here to do, is kind of help you navigate and find the right opportunities for you. But that's really reassuring to know that it's kind of built into the degree program. That's great. I believe we've got another question, so I'm going to hand over to Tom, if I may, please.
Cheers. So this is a question from Hayley.
Mm-hmm.
What do you do to keep up with new advancements in pharmacy once you're a graduate?
That's a really good question. Okay, so one thing that I did was I did the NICE Student Championship Program. And that was something that comes to the School of Pharmacy every year. I think we were the first year in which it was started, and I think it's continued since. But if not, then by all means, do ask me afterwards, and I will sort of drop a link in the Partners Summer School group on LinkedIn. And you can just sign up to emailing lists where they will email you every single day, which can flood your emails a fair bit, about what's changed. And that can be something as small as this product now has this new licensing and can be used in this manner for this type of patient. And if not that, it can include things such as now we've changed our clinical practice, so now we use this treatment first line instead of this treatment first line. So the NICE website, definitely useful. NICE is really what we use to guide most of our clinical practice. You can also find primary literature as well. If you are going to use primary literature, I would recommend using the NICE evidence search, because that does a really good job of filtering through what's useful primary research and what isn't. And then every so often, when you start your pre-registration year, I know my trust is quite active in terms of sending us emails about what's changed, especially if it affects clinical practice. And that can be, as I mentioned before, changing how we treat patients to, there's this shortage with this drug, so we should use this instead. So this year it was ranitidine, which is used as an H2 receptor antagonist to sort of lower stomach acid. There's been a sort of a callback because of a contamination issue in manufacturing. So now we're just using either omeprazole or lansoprazole. So there's lots of stuff out there which allows you to sort of keep updated. But definitely emailing lists, I definitely say that those are really useful. And they're quite handy because you always have your phone on you. So if you're not doing much, you can just have a quick skim through, read it, and you know something new.
That's brilliant. Thanks. Really useful, direct resources there for students to tap into. That's wonderful. We're unfortunately really quickly kind of getting towards the end of the session. Any final questions, as Tom's just put in the chat box there, if there are any final questions, this is your last opportunity within this session. But like we said, we've got LinkedIn and we've got Canvas. So yeah, if there's any last questions, please submit them pretty quickly. One thing we will do is end with a question from me, but I'm keen just to give you an opportunity in case there's any more to come in. Right, I'm going to go for it in that case then. If we might possibly have a couple of minutes after this, but one question we'd really like to pose to you, Nketia, is, and this is quite a big user question, so we'll put you on the spot here. But considering your time at university and your own career to date and so on, what one piece of advice would you like to share with our partner students today? If I were to ask you for one piece of advice, what would that be, please?
Oh, one piece of advice. That's a really good one. I think there are loads of different things I could say. I'm just trying to pick the one that probably stands out the most and is a bit most widespread. I'm also aware of time constraints, so I can't sort of hover around forever and wait it out. I would probably say, do that little bit more than what you're expected to do. I think that's why I really want to sort of part with. Do that little bit more. Because I know a lot of the time, and you even see it in healthcare, there's a mentality that I work from this time to this time, this is all I need to do, and then I can go home. And sometimes I wonder whether that's something that just happens because of continued practice and you go into the autopilot mode, or whether that's something that starts at university. What I'll encourage you to do is just remind you that you're working in a field where you're having a direct impact in the lives of others, many people who you won't know personally. Don't think of that as a daunting thing, think of that as a brilliant thing, because you as an individual can not only change the lives of others, you can inspire the lives of those around them as well. You know, pharmacists have a very, very important and growing role in society. And the only way that that's going to continue to be recognized is if you don't just do the bare minimum, you go over and above what you're required to do, not just in terms of your grades, but just how you conduct yourself as well. That's what I would say, because there's reward in doing above and beyond. So that's why I would definitely say that.
I think that's a fantastic piece of advice there. I'm sure Tom would agree. Fantastic piece of advice and something very poignant to kind of end the session on. Absolutely. No more questions coming in from what I can see. And as I say, we're fast approaching the hour. So Nketia, massive thank you for your time today. Again, a reminder to anyone that's joined us today, keep the questions coming by all means. Very kindly, Nketia has agreed to answer any questions after the session. I'm sure we'd all like to say a massive thank you. And yeah, please do keep in touch with us. You've got the career service here to obviously support you around, around your career decisions and so on. And I think, personally, the last thing I would like to say is that, and it's something Nketia said during his own presentation, is that, keep your mind open and open to change and open to new opportunities, and don't be afraid to maybe change the course of, you don't have to have a plan A and stick to it. And I think that's really important to remember, that, you know, opportunities will present themselves, you'll find likes and dislikes in your career planning, and that is completely normal. So expect that to happen. So an open mind is a really positive start to that. Okay, I'll draw the session to a close now, but again, thank you so much, all of you, for your time, particularly Nketia. Been an absolute privilege.
Yeah, no, it's been brilliant. So thanks for the invite, Joe, and thanks to everyone who sort of tuned in as well. If you've got any other questions, then you know how to find all of us anyway.
Thank you for tuning in to this recording of the Partners 2020 Ask the Expert session. We hope you found the discussion and the presentations from our guests useful and insightful. Remember to stay up to date with further advice from alumni and industry professionals. Subscribe to our Newcastle University Career Service YouTube channel, and you can follow us on our social media channels at NCL Careers on Facebook, Twitter and Instagram. We hope to see you in September. Good luck and take care.